We thank Art Risk for being the underwriter for this panel. However, from now on, the people you will be hearing from are going to talk primarily as people who are very intimately and long time experts in these topics. So this is not a promotional panel, but Art Risk is a organization that works with many people in the professional community on insurance. So we're very happy to have now them on board as well and be able to benefit also from Virginia's expertise. So we mentioned many of those issues we cover. As we said, we go back to and we first maybe mention them generally, then we dive into them a little more. So at the morning session, we mentioned that there are a lot of components involved in the cost of typical surrogacy journeys. We encourage you to ask the agencies, the clinics, the lawyers, more about those components that directly are quoted by them and for the professional services they provide. And in this panel, we're going to try to dive a little further in and in more depth to the part that is a little less, straightforward and varies more. The part that pertains to the surrogate's compensation, expenses that she gets reimbursed for, and many other cost components associated with the surrogate's insurance or medical coverage. And let's just be clear, when we talk about insurance for surrogates, we never expect, especially not you, to have insurance that will cover the IVF part of the medical treatment. We're talking about insurance for her maternity and maternity care and her delivery, and also then subsequently insurance for the newborn. We're not talking about insurance that's going to cover your IVF treatments per se. Of course, there are other things that we're not going to cover here, but let's just mention that there are increasing number of employers who offer IVF and even sometimes surrogacy-related benefits. This is something, if you're not on our Facebook group, this is something that we typically, provide updates about when we know about new companies. It started mostly with the high-tech companies, but others are chiming in. We created a toolkit to help those companies, especially with regards to know how to budget surrogacy and also how to feel more comfortable with surrogacy ethically, which is sometimes part of the problems that would be standing in the way for a company to expand employee benefits to cover also surrogacy. I encourage you, if you have a large employer that you think might be open to this idea, and if you need assistance, absolutely bring it up at the Facebook group, but also feel free to email me to the extent that we can provide some assistance in getting that happening. I think that's actually a very promising avenue of financing for people, or at least something that could defray some of the costs. So you have the handouts I mentioned before right now. Let me just explain, generally speaking, the first page of the handout, as I mentioned, is about the surrogacy agency and the surrogate. So this is the area where we're going to be concentrating on in a few minutes. The top are those components that typically pertain to the agency directly. And as I mentioned, we have what we see to be more of the minimum, the maximum, and the likely cost ranges for those fees. And when a fee is in green, that means that most times it's covered in the top level fee. Blue means that those are not always necessary, and whatever it is, orange or pink, no, pink is third party. So, for instance, for always the legal representation of the judicial carrier is not something that the agency will provide, but rather a third party. So that we estimate nowadays to be around $85,000 in overall likely costs. And then the second sheet for that part, and the second sheet is the egg donor up at the top. And we really mostly assume a scenario in which the egg donor is coming from the clinic, but you know, as I said, sometimes she would be found by an agency, and then there will be a matching fee. And then the bottom are the medical costs. And that would add up to around $43,000. Now, those numbers in both cases are, so about $130,000, are for no contingencies, a journey. Namely, you succeeded in the first try, there were no twins, there was no bed rest. These are the components that you can count on being there. Then the contingencies will be additional to that. And generally speaking, I guess that's something we're going to talk about here. Every agency will give you some guidance, and that's what we're going to ask them about, how to account for that when you're budgeting. So this is, you know, don't expect to follow line. We're not going to talk, you know, line by line. This is not what it's about. I just wanted to give you a general orientation about this document. And the way we created this document is by first comparing a lot of cost sheets we got, but also talking to the agencies and the clinics, and in turn also using the feedback loop we get from GPAP stage 2 people for whom we budget this, and we count on that budget to be accurate. And when things change, we change it back in our cost in our Excel sheets. So if we see that consistently satellite or monitoring costs for the surrogate are not in the whatever $1,500 range, but $2,000 range, we would eventually change it here as well. Okay, so we'll start with you, and the format of this panel is such that I will present a question and address it to one of the panelists, but to the extent that the other panelists have you know, something to chime in about, and to the extent that we can still do that within the time frame we have, we'll do that as we go. So I will address the first set of questions to you, Stephanie. You want to just give us a general understanding, a general overview of surrogates compensation, and we're not talking about insurance yet, about what are, you know, the various typical components as far as base compensation, other parts of that, and including benefits that sometimes are part of that compensation package.
Okay. Typically in the state of Texas, compensation has been ranging between $35,000 and $45,000 as a base compensation for surrogates, from inexperienced to experienced. So of course the larger compensation can be for an experienced surrogate. Depending on whether she's done this 2-3 times. We usually don't go past $45,000 to $50,000. On top of that, you're going to have trends that surrogates are looking for as far as additional expenses are going to be things like chiropractic care, also housekeeping in late pregnancy, especially if they're carrying twins. We typically do housekeeping anywhere from 30 weeks and beyond with a singleton, and 25 weeks and beyond with twins. So you're going to be looking at about $75 a week typically for housekeeping if your surrogate requests that on top of her base compensation. Also on top of base compensation, you're going to be looking at a monthly allowance. Monthly allowance includes things like the cost for mileage to and from doctor's appointments at the current IRS rate. Also co-pays for her prenatal care and delivery. Prenatal care prenatal vitamins, things like that. Anything that's going to be a typical expense for her on a monthly basis is something that's included under that monthly allowance. So she does not need to send in receipts and stuff like that for it. As far as compensation goes, and as the trend is, it's going to go up. It's going up constantly. It's every year. Different agencies are bringing up the cost for compensating surrogates. Just like anything else. I mean, rent, car payments, everything is going up. So back in 2000, let's say 2002, 2004, compensation for a surrogate on average was $18,000. You know, now we're up $35,000 and above. And outside of the state, you can expect $40,000 and sometimes $45,000 above for an inexperienced surrogate.
Well, thank you. And then there's I don't know if you mentioned do you still see a lot of times surrogates getting extra for good insurance or?
Correct. Like with my surrogates, for instance, if they do not have insurance and we need to vet insurance for them and get them a policy in the state of Texas through Blue Cross Blue Shield, we have our surrogates lower their compensation to make up for that policy. So an inexperienced surrogate that would start at $35,000 would lower her compensation to $30,000, and you would pay for the cost of her policy during the pregnancy.
Some agencies, or at least it used to be such that it was the reverse. The assumption was that they don't have good insurance and they get extra if they have good insurance. I guess you're starting with the assumption that they have insurance and
Correct.
you're reducing it. But the bottom, so that's actually a very good tip for you to kind of ask whether that initial number you're being quoted is with insurance or without insurance. And we'll get to that in a few minutes, just explaining what do we mean with insurance, without insurance. We're not literally talking necessarily about a woman that doesn't have health insurance altogether, but we'll get back to that in a few minutes.
There's
Any comments about this? Because
so
I want you, Steve, so, and you're going to talk about that, the whole survey in a few minutes. Is that okay?
okay.
Oh, you know what? Why don't you talk
Well, I was
right
just
now?
going to mention about some other surrogate fees that you might have. You're talking about base compensation is for the pregnancy itself, so once a pregnancy is achieved. However, your surrogate is doing work and having some things happen before that. So sometimes there's a fee for when she starts medication because those medications are disruptive to her life and cause discomfort to her life prior to actually being pregnant. Traveling to the clinic. So in my case, I had to, drive 5 hours to go to the clinic to do the transfer and things like that. So there would be travel time for that, lost wages for a day off work, lost wages for a spouse for a day off work to travel with that. So those are some things that are going to be different depending on who your surrogate is and where she's at.
And there are fees for invasive procedures if you do testing beyond what's necessary, if it's even allowed. There are fees associated with loss of reproductive organs if that happens, and it does happen, things like that. And let me just mention in general, while your agencies might have some of these guidelines up front, at the end of the day, it's the match sheet that will determine those things for a surrogate, and then the match sheet will then be translated into the agreement. That mythological 80-page agreement we were talking about for the last couple of days. So Steve, when you have an IP or a couple come in and you need to try to explain to them all these line items that say variable, and that's not something that is easy to live with. How do you go about that? Because as Michelle mentioned, there are a lot of variable costs. Like we don't know where she's going to live. We don't know if she's going to have a spouse that's going to come with her or a friend or all those things. Do you want to talk about those variable costs?
The first thing to understand is that every contract is unique. Every agency is unique. Agencies are not regulated. They vary from state to state and region to region. And even within the same states, different agencies offer different compensation packages and have different standards. So it's important to talk to your agency about what your agency's assumptions are, because that is going to create the assumptions of their carriers, because the agency is going to tell the carrier what to expect, and the carrier is going to carry those expectations into your contract negotiations. There are variations not only from agency to agency, but geography to geography. A hotel room and a steak dinner is more expensive in LA than it is in Fargo, North Dakota, and more expensive in New York than in Minneapolis. And surrogate fees in the Midwest, 25 to 35 is still a range that's reasonable. In California, it's 45 and up. So all of these things are variable. There is no right or wrong answer. You need to be educated about what the line items are for. The agency will have created some expectations on the part of the surrogate, but you are the one that ultimately decides what to offer. And you have to understand whether your agency is going to let you vary that or not. And those are questions you should be asking, because maybe some of you hope to do that. And if the agency is not going to facilitate that, you need to consider that. when you enter into the contract, one of the expenses that's been mentioned is the monthly allowance. The monthly allowance, just to be sure you're clear on that, is an amount that the surrogate gets automatically every month for certain variable expenses that are not cast in cement that she doesn't have to provide receipts for. So it's an estimate. Some agencies use that to entice surrogates to work with them, and they pad in there a large number that is far in excess of the expenses that are actually covered. So what it becomes to you is a hidden additional fee. And you should ask your agency, how have you calculated that? What expenses are incurred, and what's the average amount of those expenses over a journey? Am I just paying her an extra $200 a month? Or is it reasonably related to the expenses you have listed that I don't have to get receipts for? You need to be educated, and there are so many questions that you have to rely on the transparency and integrity of your agency to make sure you're getting all of this information accurately, so you can make an informed decision. There are many variable expenses, and some of this ties into insurance, and I don't want to get into the insurance itself, but the cost of your surrogate is not just the fee, and a topic that just came up is, if a surrogate has good insurance, does she get a higher fee? If she has bad insurance, does she have a lower fee? Yes, in general, not always. And what does that mean, good insurance? At one level, it means she has insurance that will cover her maternity and delivery. That's the bottom line. That's what Virginia is expert at locating and implementing for surrogates. It also means, how much is that insurance going to cost? How many of you have insurance? Raise your hand. Ha, you didn't know it was interactive, did you? Okay, you all have insurance. Do you think every one of you has the same deductible? No. Every insurance policy has a different deductible. Some of you pay $500 in cash before coverage, some pay $10,000. Do you all have the same out-of-pocket maximum? Meaning the maximum amount you pay in cash before insurance covers 100%? No, you don't. Some of you have a $2,000 out-of-pocket maximum. Some of you have a $15,000 out-of-pocket maximum. You know what? Same is true for your surrogate. So you may get a surrogate with a $35,000 fee, but her out-of-pocket maximum for her maternity expenses may be $15,000. That's a $50,000 surrogate, guys. Or you get a $30,000 fee with a $3,000 out-of-pocket maximum. Now you have a $33,000 surrogate. But you have to look at fees and insurance together in terms of assessing your cost. And those are
and you're
questions.
not going to know that necessarily when you sign up with the agency, because the surrogate would not have been identified at that point yet.
The surrogate will not have been identified, but you need to have an agency that says at the point of matching, you will be given that information before selection, so that when you're assessing candidates for matching, you can pick a candidate, not when you sign up with the agency, but at the point you're matching, taking those factors into consideration.
So let me ask you something, because we spoke earlier, and I'm asking all of you, about the fact that sometimes there would be a trade-off between cost and time. So in this particular case, if somebody came to you and say, we're not that much in a rush, we'd love to have a child already, but we're willing to trade off a longer process with lower fees. What are the variables that they can try, the attributes that they can try to seek in a match? And they say, we're willing to wait longer until that particular surrogate arrives. So one variable we just mentioned is insurance. What are the other variables that would affect how much the overall package is going to be, and maybe are realistic to attain?
Mm-hmm. Well, all of the numbers that have been talked about, from the fee to the insurance to the monthly expense reimbursement to the C-section fee to the multiples fee, all can vary by surrogate. And what I run into most often is agencies generally have a proposed C-section fee or multiple fee. Some surrogates will ask for more. So when you're waiting for a surrogate candidate, that match sheet, what she expects, what her fee is, what her insurance is, what her monthly expense reimbursement is, all go into the overall cost of that carrier. And it's very important for you to understand that surrogacy in a cost effectiveness process is time versus money. The more you're willing to spend without controlling your budget, the faster you can go because it broadens the scope of surrogates that are economically acceptable to you. The lower you want to drive your cost, the more you're going to have to be patient until just the right surrogate with the right combination of costs comes along. And all of those factors are going to enter into that assessment.
So some of the components we see, of course, is whether the surrogate is experienced, quote unquote, or not. We spoke about that before. Another one is, of course, her location. Now, you mentioned the fact that costs could vary for some of the travel expenses, but keep in mind that it's where the clinic is going to be located, where this per diem, lodging and food are going to be in effect. She could live in Fargo, but the clinic might be in downtown LA or in Bel Air somewhere, and that's where you'll be paying for her to stay because she'll be flying there. We already spoke about proximity to major airport. She might be in LA or Las Vegas and very far from the clinic, but there are lots of flights going there, but she would be in, I don't know, Medford, Oregon, and only a few hours driving distance for some major airports, but she will not drive to the airport each time. One other thing we're seeing is, let's talk about that for a minute before we go into insurance and other aspects, is perhaps something that I was not even aware of as much, or is hard to is easy to forget, easy to remember to forget, is that there's a lot of fees that are on the clock. Once you have the surrogate on contract, she gets paid for them, and the longer the process takes, the longer she gets paid. So sometimes timing is a big issue, and I'm not even talking about even the timing of the Affordable Care Act contracts, but is this something that you can control a little more? Stephanie, perhaps, do you want to talk about that?
I believe it's good if you can start working on your donor first before you start working on your surrogate. I see the most hiccups with donors than anything as far as timeline goes. You don't want to have your surrogate waiting while you're creating embryos a lot of the time, because if anything happens, then your surrogate's going to be sitting on hold, and then you're going to incur not only her monthly allowance while you're under contract with her, but it's also a delay fee. What else?
Yeah.
That's about it.
And then sometimes between tries. So
Correct.
So if the surrogate is not the surrogate, if the transfer is not successful, then as you wait for the second transfer, she still gets paid all these fees.
Correct.
So just keep that in mind. Now, this is not something you should be thinking on your own, but now you know that, but it's something you can talk to the agencies, and the good agencies will absolutely make sure that you're aware of that. General rule of thumb, we suggest to people, create embryos first. The first thing you do when you start this, you might want to have the whole plan laid out. You might already be on the queue for a surrogate, but the first thing that should happen is, since frozen embryo transfers are so reliable, is create the embryos and don't ever, have a surrogate waiting for the embryos to be created. Do you agree?
I agree.
Yeah. So, oops, what did this happen? Okay. I just want to mention that when you ask the agency for, maybe mention that you're willing to wait a little longer and ask for this really a unique surrogate. First of all, keep in mind that if it's an agency or a clinic that still allows multiple embryo transfer, surrogates many times do not even want to consider multiple embryo transfer, so you'll wait longer, period, if you want a surrogate that's willing to carry twins. And on average, they'll be less flexible about their compensation, even if there's no explicit, beyond the explicit $5,000 or so that they will get if twins actually occur. And then the other thing I want to mention is that maybe you want to weigh in on that, is that as this part of the surrogate's characteristics is whether she works at home, whether she's at home, whether she works outside, whether she has
School.
whether she has smaller children or older children, whether she has the insurance, disability insurance. So those are all things that would eventually affect how much you're paying her if she's on bed rest, when she's away from home. You know, so you can say, I want a surrogate that has older children and works in a very low wage profession and has disability insurance. Wouldn't that be the ideal scenario or something like that?
Yeah.
Okay, why don't we pause for a minute before we move to insurance, which is the cherry on the cake. And Michelle, you've been doing work with surrogates and even a survey recently. So you put a lot of thought about the various components. Do you want to maybe first share what you've been working on, and also, you know, some of those trends we just mentioned here and how we feel about them and what might be done about them?
Right. So the first thing we put together recently a survey for surrogates and for IPs that just asked about the cost that they received, and there's pretty clear similarities even amongst just on the kind of the standard fees. Aside from the base compensation, there's a lot of flexibility in that base compensation is what we found, but the you know, med start fee and the transfer fee and those are pretty close into it. We asked at the end of that survey if you felt that that was a fair compensation. And the answers were really interesting in that most people said yes, regardless of the amount. So even the surrogates who had $20,000 compensation and the surrogate who had $60,000 compensation, the answer wasn't different unless the journey was terrible. So if they had a lot of complications or if they had a disruptive relationship with their IPs, then that answer was not clear. So what we're saying is that the compensation, the feeling about that is a lot different when the journey, depending on how that journey goes, which makes sense because you're being compensated for that disruption and that risk and that discomfort in your life. And if that is heightened because of some complications, then what you're receiving might not seem adequate. We are seeing a lot of increases in the base compensation fee, and also we're looking at having some sort of guidelines or structures for that to mitigate that, and also to think about those compensations that come prior to pregnancy. So again, that base compensation doesn't start until you were pregnant, but you might have had 3 transfers before that you even get to that, and your life has been disrupted and on hold for 3 months, 6 months, a year while you're trying to get to that point, and that can sometimes be just as uncomfortable as actually being pregnant. So,
and we hope to be able to contribute to some better understanding and maybe better structures for compensation. But I guess once again the takeout is that a lot of these things are subjective, and the surrogate that has good experience medically, but also with you and the relationship, is going to feel better all throughout, including about her compensation. And as you understand now, we're not talking about a one-time compensation. We're talking about things that happen along very long period of time, and some of them change throughout, and your relationship is already a factor when that happens. Surrogate that doesn't have a good experience with a couple might be more adamant about taking advantage of every single clause in the agreement to make sure she gets every single thing that could potentially be applicable. Whereas when the relationship is more organic and supportive and everybody's happy, then you might not have some of those things even come to bear.
I don't remember the percentage. I should bring those results with me. But one of the questions we asked was, did you incur expenses that you did not request reimbursement for, even though it was in your contract? So I bought this item that I could have sent in a receipt for, but I didn't send in a receipt for. And it was something like 80% of the women who say, yep, I spent my own money and I didn't send that receipt in. Whereas, like you said, if you are not having a great relationship with them, I'm going to send you that $8 receipt for that prescription that I had to get because, just because I can. Where most of us have probably spent a few $100s that we just, it's not worth the time and the effort to send that in.
Yeah. Terrific. Let me just mention that there are other variables that come up in those agreements, including sometimes there are caps associated with some of those benefits. The one thing that varies from one agency and sometimes from one clinic to the other are whether the bed rest compensation or bed rest reimbursements are capped in any way. So the assumption is that if a surrogate really needs to spend a lot of time at home or under certain restrictions because of the pregnancy, the way the pregnancy goes, up to a certain point she gets that compensation, and then it's get capped, and basically she starts eating into the base compensation. Some agencies do not consider that to be a valid practice. Others think it's very important to protect the IPs that way. I just want to, I don't think we need to debate it, but I just want to highlight that that's something that varies from one agency to the other, and you might want to ask that, and it is certainly something that might be negotiated. So there are, we should mention, times in which many of those aspects get negotiated, and a good lawyer for the surrogate might, ask for some things that might not even be in the original. Not a good necessary. Go ahead. But briefly, because we need to get it to insurance.
Yeah, so just a brief comment on caps. I want you to understand, a cap means if you go on bed rest for 6 weeks and you're a nurse and your salary is $90,000 a year, that can be a lot of money. And you say, but I have to be able to afford my journey. I want to cap that at $5,000 or $8,000 or $10,000. And what you're saying is if she's on bed rest longer than that, and she's lost more wages than that, because she's helping you in your process, you are visiting an economic loss on her, expecting her to contribute her lost wages to your process. I personally do not believe that's acceptable. I don't think caps that eventually transfer the cost of your process based on the interference in her life to her economic loss is fair. So if you start working with an agency that has those or thinking that that's a great idea for you, I want you to think about that philosophically and whether that is a fair thing to ask a woman that's given her health risk and her time and her family energy to your process.
I mean, some agencies would then say, and I'm not taking sides right now necessarily, that since base compensation has been creeping up, then it's not the end of the world if, under certain circumstances, she shares the risk. We think as an organization that the surrogates do not need to share the risk with you to, contingency situations like that. That her compensation, if it's fair, then it's fair regardless of whether luck, had it that she needs to be in bed more. But I think what's more important is, and we've just seen that as closely with one of our GPAP couples, that at the end of the day, if she has a cap and she still needs to be in bed, you'll be forced to say, sorry, we're not paying for that. And she'll say, okay, I'm going back to work. Or you're going to be in a position to say, no, actually stay at home and we'll pay more. So at the end of the day, it might not even be practical to have those caps, because many times people are going to be afraid that she might even say that, but she'll go back to work and you're not going to know what's going on. And if the doctor says she shouldn't be working, then she shouldn't be working. Okay, let's move on to the insurance situation. So Virginia, can you explain first of all some of these concepts here? What does it mean to have a good insurance, a bad insurance? Because we're not talking about personality.
Any insurance is good insurance.
And then talk about also what are the solutions, but also sometimes issues pertaining to timing and waiting and all these other variables that we need to think about.
So any insurance is good insurance, but then within that range, you can say, well, again, as Steve pointed out, how high is her deductible? How high is the out-of-pocket maximum? How is it a family out-of-pocket maximum? So if she has her children on it, does that $6,000 become $12,000? So those are all things that when an insurance review is done on her insurance, you should find that out, because that can, again, make a big difference. So we always start with, does she have insurance, yes or no? If she has insurance, will it cover a surrogate pregnancy, yes or no? Because if she has insurance, that will cover a surrogate pregnancy. That is your least expensive way to go. And then if she doesn't, what are the options? So one option would be
Just let's just explain, why would insurance not cover surrogacy, and is it always straightforward, yes or no, or are there sometimes ambiguities?
every insurance policy has like a list of rules of what they will cover and won't cover. And some of them have very well written and very nice exclusions that say, you know, we will not cover a surrogate. And then they go on and define what a surrogate or a gestational carrier is. So those obviously you would not want to use. Others are ambiguous and they have terms such as surrogate parenting. I personally don't know what that means because there's really no such thing as surrogate parenting. But so that's an ambiguous term, and how do you handle that? And when we do insurance reviews, we basically force the insurance company to the best of their ability to define that for us. So do we think that that's going to cover even if it's an ambiguous term? It is up to the insurance company to explain it in such a way that the common man would understand it and use it. So ambiguity works in favor of the insured, not in favor of the insurance company. That being said, you're going to assess more risk potentially in ambiguous language. It also, is it a union trust plan? Because if it's a union trust plan and you have ambiguous language, you have a bad situation because they can do whatever the heck they want to do because the law is a little bit different for them. So there's just some things that that you need to know that it's not always as straightforward. Oh, she has insurance, yay. Because we do reviews where the agency, well, our agency swore it would cover. Yeah, it's not going to. And so those are things that you really need to know going in. So once we assess that, then we can go in and say, well, now here are your options. So one option, we've been very lucky with the Affordable Care Act in that a lot of those plans will cover a surrogate pregnancy. But you can only enroll, this year it was from November 1st to December 15th, unless you were in 9 states, California, Minnesota, and a few others that extended it. That was it. So, and then it would be effective January 1. So that's where timing comes into play. Do you want to wait and do a transfer in November so that by the time she's released to an OB, you have insurance January 1? A little more cost effective if you do that. The downside right now is where we are with the ACA and what's going on in Washington. I can't guarantee it's going to be around because it definitely is imploding. This year we had a lot harder time finding surrogate-friendly plans. Texas actually was a really pretty good state. There are several plans that will cover surrogate pregnancy in Texas. But there are some states that it was really, really tough. And then what we're finding are really small networks. So, you know, it might be a plan that covers surrogacy and you have a choice of 5 OBs. There you go. And then people are like, well, these are only OBs that nobody would use. Well, that's probably why they're in the network. So, you know, you run into things like that. And then you have to say, well, is that acceptable to me, yes or no? And if it's not, then again, we have to reassess. There are plans that are created for surrogacy. So we know it's going to cover a surrogate pregnancy. They don't have a network of providers. You have a lot of freedom of choice. They really work well, but they're expensive. You know, you're looking at $26,000 to $28,000. So, you know, you go from the best situation where she has insurance that will cover a surrogate pregnancy to, well, you know what, to having to buy a plan that's expensive. So it's kind of all over the board when you look at that. Because the cost of insurance has risen and deductibles have risen and out-of-pocket maximums have risen, those plans where we used to say, oh gosh, $6,000 to $8,000 and you're good, some of them this year, honestly, we're seeing premiums of $900 a month and, you know, out-of-pocket maximum of $6,000. Then how long is it going to take? Are you going to 2 calendar years? Because January 1, guess what happens? Rates go up. Policies change. So she might have had a plan that was perfect for surrogacy and then they added exclusionary language. You know, January 1, so now what do we do? Because she's now 6 months pregnant. Deductibles reset and out-of-pocket maximums reset. So when you're using standard insurance, you have to remember that everything resets January 1. And that will add to the cost if you span 2 calendar years. Whereas the plans that are created for surrogacy, the deductibles, no matter how long it takes to get there. You know, so it's a little bit different situation, but they can be more expensive.
Virginia, can you just give us a general sense so that people understand the order of dimension we're talking about here? If one does not have insurance at all, and there are no major complications, what are we talking about as far as maternity and delivery?
Sure. So if you have no insurance at all and you're just going to say, I'm self-paying, a lot of it depends on where you are, what hospital, what doctor. There's a ton of variables. But usually I would say that you can do the entire pregnancy with anesthesia, ultrasounds, lab work, all kinds of good stuff for somewhere between $8,000 and probably $12,000. But I can't guarantee you there's not going to be a complication. So if you say, I'm just going to cash pay, and you don't back it up with some type of a catastrophic plan, and her medical bills are $100,000, you're now responsible for that. So that's the downside of cash paying, because I tell people all the time, if I could guarantee you a complicated free pregnancy, I would tell you to pay cash. Don't buy insurance. I can't promise you that.
So would a valuable strategy for some people that are more more risk prone, they don't mind taking some risk, would be to cash pay with a very low premium, high deductible or high whatever copay, catastrophic coverage only.
Yeah, except that those plans typically are going to cover the surrogate pregnancy, so I'd let it go. But there are plans available where if you want to cash pay, you can put in a very high deductible plan behind it that was created for surrogacy. So it gives you the freedom to cash pay, and then also have a financial stop loss if everything goes to hell in a handbasket. So those work well. Some people just feel they can do a really good job of controlling those costs. It's a nightmare to find every bill and pay it, but that's, there are people like that who like to do it. So they go for it.
Just before we open it to some more comments on this topic, let me just say, because we do have only 4 minutes, there's also the issue of the newborn insurance. And for all of you, I think, is anybody here not an American resident, not a U.S. resident? So for some of you, for those people who come from, who are not residents, then that becomes a huge issue. But let's just refer to when you are a resident. Your newborns are covered by?
When you're a resident, then the newborns are covered by your insurance. So the newborns should go on your insurance plan, which if you let your insurance company know you have a new baby, it will be put on the plan going back to the date of birth. You just have 30 days usually to do that. So you want to do that, and then they pick up all the medical bills. Another option is if you're a U.S. citizen and are a U.S. resident, you can actually find a newborn plan and just put the baby on health insurance, because that's a qualifying event, birth is a qualifying event. So you can just add the baby at that point in time, and then that will cover back to the date of birth also. So when you're a U.S. resident and you have health insurance, you have like 2 ways you can go. And really it depends on where is the baby born and whose insurance is going to cover it.
Michelle, I think you wanted to say something, and then maybe Steve.
Yeah, I was just saying that one of the in insurance, one exclusion I've seen more recently is that they will cover the cost of surrogacy, but then the surrogate, it has to be reimbursed. The surrogate has to reimburse that up to the cost of her compensation, and that is something that we actually did on my last journey. So that's one more piece that you might need to be double checking on your when you review that insurance.
Go ahead, Steve.
So it's clear the surrogate needs a policy on herself for the maternity. If you're a U.S. resident with a domestic health insurance policy, we have no cases that your company won't cover your child retroactive to the moment of birth, which doesn't mean you can relax, because there are cases that have said, if you don't call your HR department or your insurance company and know how they want you to add, when they want you to add, and what the procedure and documentation is. And if you don't follow the rules, even if you would have had coverage, they will deny you, and they will deny you successfully. I had one case, rightfully or wrongfully, where a couple had a surrogate in another state, reported it to their insurance company within the 30-day period, and the insurance company said, oh, you needed to pre-authorize. You didn't. You're going to pay those $70,000. You need to talk to them before the birth to know what their expectations are to stay out of trouble. And even if they're going to cover, it's going to be a different cost depending on whether The surrogate, who is perhaps living in another state, has a health insurance policy and goes to a hospital and doctor in network. And you all understand if you go in network, it's a lower deductible and out-of-pocket maximum. You pay less money. So she's going to use an in-network facility so that it saves you money. But you live here and you have insurance in Texas. Is your insurance policy for the child that will be at the same hospital also in network
At that hospital.
for the hospital? So that you're also paying the lowest cost under your policy. Because again, if you have twins and they're early and you're out of network and it's an unlimited out-of-pocket maximum, it's going to hurt. So there are questions to ask, and the professionals that are helping you should be telling you what questions to ask and guiding you on that journey.